everyone. Welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Cerebral palsy, or sometimes called CP, is a group of movement disorders that appear in early childhood. Signs and symptoms may vary between people. According to the Centers for Disease Control, CP is the most common motor disability in children. It occurs in approximately 1.5 to more than 4 persons per 1,000 live births. Cerebral palsy was found to be more common in boys than girls and more prevalent among black children than Caucasians. Our guest today is Dr. Femi Daniel, an internal physician and neurologist at the Lagoon Hospitals in Lagos. He is also a member of the West African College of Physicians. You're welcome to the show.
Thank you very much, Mrs. Sue. Thank you.
So what stands out here is movement disorders.
That's right.
But what causes these movement disorders?
Okay, thank you. The definition you give, which should encompass the cause, says abnormality of posture and movement.
Okay.
That is the result of a non-progressive damage to the developing brain.
By non-progressive, you mean that the damage is once and for all?
It's completed.
Okay.
Whatever we are seeing are the sequelae or the aftermath of that damage. It happens that as the child is formed, the brain, begins to develop. The central nervous system, which includes the brain and spinal cord, starts developing by the 3rd week of gestation within the womb. Now, anything that, disturbs the normal proliferation of cells here, the normal, development of that nervous system at that time can actually give rise to far-reaching consequences, especially as the child grows older.
Okay.
So that what you have is a damage to areas that control movement and posture. But cerebral palsy goes beyond that. You can have abnormalities in cognition. That's the ability for the child to carry out mental, activities.
Oh, it affects intelligence.
It affects intelligence. They can be subnormal in their intelligence. They can be retarded in intelligence. They can have, they can be visually impaired. They can be auditorily impaired, meaning they can't hear. They have speech and swallowing problems, besides just the abnormalities of posture or movement.
But what would cause this? Is it because the mother fell down when she was pregnant, or what?
Okay, in medicine we talk about the cause of conditions being traumatic, infective, neoplastic as cancer, drug-induced, genetic, or acquired issues. So that a child that is being formed within the womb can be disturbed in his growth either by maternal issues or issues that have to do with his own development. So we talk about maternal issues or fetal issues. Now, maternal issues will refer to things like a severe infection of the mother or the use of a drug.
Could it be rubella, for example? Because that is always such an issue.
So you're talking about rubella, Torches syndrome. There's a group, a constellation of infections that are very, very popular in expectant mothers. They call them the Torches group of infections. Toxoplasma is a parasite. O for others, but R for rubella. You have E for Epstein-Barr, you have C for cytomegalovirus. There are so many kind of viruses, and the S is for syphilis. They can affect the growing child within the mother just because the mother has acquired that infection. But you can also talk about things like severe malnutrition in pregnancy. Okay. You can talk about things like drug use, like I've said. You can talk about multiple pregnancies. The problem in multiple pregnancies is that whatever is affecting one of the babies so severely puts the other baby at risk.
When you say multiple pregnancies, do you
like
mean many babies at a time,
twin
or many births?
No, multiple pregnancies, just twin pregnancies, triplets or quadruplets. Okay. All right. If there is some problem in the growth in the development of one, for instance, one of the twins gets so severely ill, the other may also get affected. Even if you lose the first one, you can have one that comes out with a serious central nervous system condition. Okay. So other things like, while you're giving rise to the child, you have infections that can cause, damage to the what you call chorioamnionitis. A woman ruptures her membrane so early in the course of labor and then infects the child as it's coming out of her birth canal. Sometimes the birth canal is too narrow and you want to help assist the delivery. The use of mechanical instruments can actually damage the child's, the
so
scalp.
Obstructed labor
and traumatic deliveries can actually cause severe damage to the brain. In the early childhood and early neonatal period, you have severe infections, especially meningitis, which is the infection of the membranes that surround the brain.
Okay, so we're talking about infections that can happen after the child that has been born.
During childbirth, and even before childbirth. So, and then, you know, cerebral palsy actually is said to be a damage of the developing brain. The truth is that the brain continues to develop, although at a lower rate as aging occurs, as one grows older. But in the very early stages, the rapidity with which those cells are dividing and the rapidity with which the development is occurring happens so fast that damage to one section can actually affect so many other components of the brain. And many of these things begin to manifest themselves as the child grows. So what you call delays in developmental milestones. So a child you expect to start smiling at his mother by the age of 6 weeks, or to be able to, you know, control his neck by the age of...
Okay, so these are the symptoms now.
These are some of the symptoms you find. So the child is floppy. You know, you expect a child who's born, for instance, to be able to give a strong cry, to be able to, you know, wince when he's pinched and cry, and you expect him to be pink and to move, and his tones and his limbs are all moving with, you know, very, a healthy child is easily known. But when you have a child who's silent, who's not breathing well, who's limp, or floppy is the word we use, that child probably has some damage. And that's why we talk about Apgar score. Apgar score is something we use to monitor the progress of a child just after birth. It's called, you know,
sometimes it's over 7, sometimes it's over 20.
So we're trying to assess certain parameters in the clinical status of a child. What's his appearance like? Is he pink? Is he like that? There's enough blood flowing through his veins and on his body. Is the pulse rate fast enough? Because if he's very slow, it suggests that he might have a problem. Does he respond to stimuli? That's grimacing. And is he breathing well? His respiratory rate, is it good enough for you? And that's why you find people saying, look, once the child comes around, try to make sure that he's not plugged in or clogged in his airways so that they can breathe well. Because there's an entity called birth asphyxia, which is one of the most common causes of cerebral palsy. Because of a condition called hypoxic ischemic encephalopathy. It's big name for saying... That means
that oxygen doesn't get to the brain.
I think you get it.
Thank you very much. Those are big words.
That's all right. So you have to, you know, appreciate the fact that at every level of delivery, at every level of pregnancy, there is a need for us to be able to be vigilant, to be able to intervene at the point it's necessary. This is one of the reasons why one has to emphasize the need for better supervised antenatal care services.
Okay, before we get to that, it seems that it's easy enough for a doctor to identify cerebral palsy at birth.
That's right.
But the question I want to ask is, can they discover it in vitro before the child is born?
Well, that's a bit, that can be done. You know, if you have ultrasound scans that look at the movement of a child, or the way you expect a child to swallow amniotic fluid at certain rates.
Oh, they catch them swallowing the fluid.
They do that. The child continually swallows some of the fluid. You know, it's like it's in his own home in the womb of his mother. There are rates for certain activities which are physiological in nature, which, if they are slower than normal, may suggest that the neurological function of that child is slowed. Most of the diagnosis we make is actually at, you know, at birth or before the age of 18 months. These milestones that I was trying to talk about are some of the things we use. So the child doesn't sit on his own by the age of 9 months, or he's not walking by the age of 1 year unassisted. Can point you to say, look, this child it doesn't seem to have attained the milestones at the age for which he's supposed to. And then you can find a child preferring to use one side of his limbs rather than the other. Or perhaps he seems to have abnormal twisting movements, or he just seems limp. And therefore you begin to think to yourself that, look, or maybe he tries to swallow and he doesn't take the food down. Or you find that
then there will be choking.
Then there will be choking. There is aspiration of food. So you have intelligence which is reduced for that age.
But is it always like that, this intelligence thing?
Intelligence is one of the many, you know, complications. That's involvement of intelligence or cognition is one of the many complications. The brain is so complex, or so intricate. If some sections are damaged, intelligence is affected. Some other section is damaged, you have epilepsy. Epilepsy is one other very common complication of cerebral palsy. The thing is that, look, as an adult neurologist, you definitely have to see children who are coming in, who have grown beyond the ages where they should be in a pediatric clinic. But you can easily tell that, look, this child has suffered some severe brain damage even before before meeting me. So he might have seen his pediatric neurologist or something, or the family might have become so used to it, and then he comes to you with seizures, uncontrolled.
Okay,
epilepsy.
now this is after maybe the first to 4 years.
At any time of his life. You see, when we talk about cerebral palsy, we usually say an abnormality of the developing brain up to the age of 3 years. Okay. Some authorities say up to 5. But then again, you have to realize that the brain continues to develop.